to my students. Thank you very much for accepting our invitation. Working together on a very good project, Erasmus project, we created a master's curriculum for occupational therapists and physiotherapists. It was a great work. You are now you are head of occupational therapy department at Jordan University, Jordan Just University. And I am also head of occupational therapy department.
Wow.
Wow, yeah. At Lokman Hekim University. Can you introduce yourself to my students?
Okay. I am Mohammed Nazal. I'm an associate professor of occupational therapy. I got education from the United States. My background is nursing. So I came from a nursing background, and I had my master and PhD doctoral education from the States. I have the American Board of Occupational Therapy from the States, and I've been here in Jordan since 2009. And that's where we met Professor Karuduman, and we had a very successful relationship and collaboration since then. Okay, so I can share I can't hear you.
Sorry, please share your presentation now.
Okay, all right, perfect. So, so I told you a little bit of myself and our relationship with Professor Karuduman and the rehabilitation team from Hajjatjabeh and Lokman University. It's been quite some history, and we had really successful collaboration. We started with a master program on interdisciplinary clinical rehabilitation, and we had very successful results combining physical therapy and occupational therapy in a master program. Here, the picture when I ever come to Ankara, we always go to the different restaurants, and I don't know if you remember where we've been, Professor Karuduman, here in this picture. I am from Jordan University of Science and Technology, and this is the picture, the photo of our campus. I will share a small video so you can have a sense where is my university. So thank you so much again for watching. I have a special guest with me. I would like her to introduce herself. Move on.
Ben burada Erasmus öğrencisiyim. Beraber aile üzerinde çalışıyoruz.
Sesin az geliyor. Biraz daha mikrofona yaklaşabilir misin Ayşe?
Tabii hocam, kusura bakmayın. Türkçe mi yoksa İngilizce mi konuşayım?
Türkçe söyleyebilirsin.
Türkçe tamamdır. Merhaba öncelikle herkese. İsmim Ayşe Şimşek. Hacettepe Üniversitesi'nde doktora öğrencisiyim. Buraya Erasmus ikili anlaşması ile geldim. Şu anda Doktor Nazal ile beraber Erasmus programını yürütüyoruz ve çalışmalar planlıyoruz. Doktor Nazal Occupational iş uğraşı terapisi alanında çalışıyor. Buranın imkanları çok güzel. Üniversitede herkes çok misafirperver. Bu kadar şu anlık söylemek istedim.
I don't understand anything, but we will have more time for the students if they want to ask Aisha.
Okay. She's very happy.
Yeah.
Very happy. Yeah.
Yeah, definitely. Thank you. So we'll go back. Okay. So the question that is always we have is when we meet people, when we meet new people, what occupational therapy is. And you meet people in the elevators and sometimes it's really hard to explain. And what is occupational therapy? So occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. And we struggle sometimes to define occupation. So occupations refer to the practical and purposeful activities, including self-care, leisure, work, or education, or anything, play. So OT through occupations allow people to live independently. They are vital to mental health, identity, and overall well-being. We always say humans are occupational beings. So whenever you meet someone, the first question we'll ask you about after knowing your name is what you do. So we are actually concerned with doing. So a lot of the things we do is concerned about doing and inability of doing something. So, but we sometimes have struggled to really define ourselves and distinguish ourselves from other professions like nursing, special education, and physical therapy. So sometimes you introduce yourself and you introduce your work and you get credit as a physical therapist, and patients don't know exactly what is the difference between physical therapy and occupational therapy. So let's start with the historical look at 100 years of occupational therapy, and we'll get back to that. So
with backgrounds as teachers, secretaries, and artists, the occupational therapy reconstruction aides worked alongside nurses teaching handicrafts, as well as vocational skills, to distract the injured, increase physical activity, and improve morale.
I took tools into my ward every day, and after I told them to make their beds or help them make their beds, I would do something that was fairly showy. And they'd gather around me. From that day on, everybody, I had 90 men working. It was thrilling.
Throughout the 19th century, The influence of the moral treatment and the arts and crafts movements inspired physicians, nurses, and social workers to use occupation-based activities to engage the mind and hands of patients.
Idleness, too long continued, is as deadening to the spirit as it is disabling to the body. It too often means degeneration, and in the end, increased suffering.
At his workshop for nervous invalids in Marblehead, Massachusetts, Dr. Herbert Hall prescribed occupation according to his work-cure theory of using arts and crafts to promote self-esteem, employment potential, and better health.
Whatever the work, let it possess a certain dignity and the culminating sense of time well spent, even though it be within the four walls of a sick room.
Boston nurse Susan Tracy began noticing the benefits of occupation for relieving nervous tension and making bed rest more tolerable for her patients. At the Adams Nervine Asylum, she offered the first training courses for occupational nurses.
So we prescribe actually activities for patients, and they noticed the power of doing over the sickness of not doing anything. So there is in physical therapy, they say if you don't use the muscle, you lose it. It's the same thing in the spirit and the mind. If they are not doing anything, there is sickness. So this phrase, this statement, man, through the use of their hands, as they are energized by mind and will, can influence the state of his own health. So doing, and you keep doing and moving, and you stay independent, is really what matters to our clients. And we have to help them with that. So that is the power of occupational therapy, is that you help them continue doing what they like to do and what is meaningful for them. So it started with arts and crafts, but you can just name it. Gardening, play, ADLs, work, education. The sky is the limit for occupations and for what is meaningful for our clients. So what OTs are good at? So we are a client-centered profession. We make pride of including our patient, our client, with us. So our clients are the center of everything we do, because we are helping them in their meaningful occupation, in their meaningful activities. And in occupational therapy, we must take a whole person approach. We must take a holistic approach. The physical, the mental, the social, an overall package to treat our patients. If we miss one, we are doing disservice for our patients. So it's not really good just to focus on one thing, on one domain. We have to focus on all domains. And in occupational therapy, we really take pride in being holistic. So as occupational therapists, we believe that participation can be supported or restricted by the physical or cognitive abilities of the individual. So that's the person part, and the characteristics of the occupation, meaning that the activity demands of any activity you do, and the physical, social, cultural, and attitudinal and legislative environment. So we believe participation is supported by an overlap between activities and how difficult the activities or easy it is, and the individual capabilities. Can they do, can they not do, and the environment where they are at. In OT, we focus on enabling individuals to change aspects of their person or occupation or the environment. So how do we change that? So these are the tools that we play with. So, and we want to make sure that we can help the patient, help the individuals change some aspects in them, probably increasing their strength, increasing their capabilities. And we understand very well the activities and the demands of the activities. And we are masters of the environment. We know exactly how the environment is affecting this person, how it's affecting the performance of the activities. And we do a combination. We play with these three items: person, occupation, environment. We play with them and we make the best combination, the best mix for the client, just to enhance the occupational participation. And occupational participation is the word and the term that we often use to describe that the client is engaged in the activities. So if no one knows what we do, we are actually experts in the science of doing and living. And we have to take pride in that. We are so different than any other profession. And I came from nursing, but we are experts in the science of doing and living. And our actually work is too complicated to explain sometimes. And we are performance improvers. So we improve the performance of any activity when we really understand our client, when we understand what they want to do, the activity, and when we understand where the client is doing this activity. So we improve performance. And we are select and highly specialized profession with major contribution and well-being of our clients. And we have to take pride for that. And our clients can be groups, individuals, groups, community, and the society at large. And these are actually the new trends for a global occupational therapy profession. So probably occupational therapy staff and students, you noticed this diagram. It's the person, the environment, and the occupation. And the overlap between these three circles, it's called the occupational performance and participation. And I always say to my students, you are magicians. You play with these circles to make the best fit, the best match between all these, to make sure our clients are able to do things and the activities they like. And how we do that is actually, these are the essentials of a good occupational therapy performance. So we look at personal factors, and we assess and we treat as much as possible the body structures and functions that our individuals, our patients have. So if they have muscle weakness, if they have sensory loss, if they have something in the joints, if they have something in the trunk, in the muscles, if they have anything, if they have problems with forgetting, problems with cognitive functions, we try as much as possible to elevate, to raise these functions, to improve them. And also we have a beautiful understanding actually of the different activities patients do. If we don't know the activity, we ask the patient actually to teach us how they do things. And we are masters of activity analysis. So when we do activity analysis to any activity that the patient do, we understand the demands. We understand why this activity is difficult, why this activity is easy. How can I grade? How can I make it more difficult? Or how can I make it more easy? And also, we understand the environment. So the environment can be enabling, can be disabling. And as I said, occupational therapists are magicians. In a way, they play with these circles. Probably you change the occupation, and that's it. Probably you change the environment, and that's an easy fix. Or you work on all that and make a perfect match to our clients. So that's a very interesting pictures and two activities, that one is easy and one is a little bit difficult for our clients. So let's think of a client with a traumatic brain injury and some cognitive decline. So the patient is having cognitive problems and not able to follow commands, not able to follow instructions. So you can see that just using a simple tea bag can be easy, but we don't know if the patient would like that or not. Probably some clients, they don't like drinking tea from this just tea bag, and they like the old traditional tea making pots, and that's an important for our clients. So we need to understand what are the demands of this activity and what are the demands of the more traditional one. And we have to understand why this is difficult, how it's easy, how we can make it easy. And we just negotiate with our clients just to make the best match and performance. So this is another activity that also two different demands. We call it, okay, so we call it in Jordan, we call it, this is Arabi and this is Franji. So this one in Turkish, I guess, Al-Franja?
Al-Franga.
Al-Turka? Al-Turka.
Al-Turka, yes.
Which is very interesting. We call it Arabi and Franji. So these have two different demands. So when you have a patient, when we have an individual with stroke, so probably maybe at their house they have al-franja, al-turka, and this is very difficult because of the demands of the activities. So the physical demands of going to the toilet with this, it's really hard. And if we want our individuals to be independent in toileting and going to the bathroom, then we have a simple fix in the environment, and we can make it happen. And we can make the performance and the participation and the independence for the patient much better. Going to a bathroom, it's a very simple ADL, but it's very linked to the identity of the individual, to the dignity of the individual. I can't imagine myself not being able to go to the bathroom by myself. And this is really hard. So when we do things like that, very simple changes in the environment, when we do things like changing and playing with the three domains in occupational therapy, as I said, the personal capabilities, the activity demands, and the environment. When we play with that as a magician, we create better outcomes for our clients. And it's very important, and we hear it a lot, that when we deal with our clients and when we treat them, we use just the right challenge, which means that I'm gonna give my clients some challenge, but not so big. So they will keep motivated, just motivated to do more work. And when we give just right challenge activities and we create this challenge, we give them more excitement. They are doing something a little bit hard, but still they can do it. And there is a big term in occupational therapy that is reflected with the statement, just the right challenge, is that we want our patients to have good flow. So the concept of flow in occupational therapy is a very important one. And I really believe that the concept of flow is at the center of the art of occupational therapy. Because as a magician, you always create this balance. Okay, I want my patients to improve. So then I always have to increase the challenge a little bit to a degree that it keeps him motivating and exciting. If I give them too much challenge and it's over their capacity, so the demands, it's a lot, it's over their capacity, my patients will feel frustrated because it's really hard. So when I go to the session and I really can't and I'm not able to do the activities and the exercises, I'll feel frustrated. This life is horrible. I cannot do these things. So they will be frustrated. On the other hand, if I give them a little bit of demand and it's just very easy, their capacities are much bigger than their demands, they will feel boredom. They will feel bored because they are not using the exercises very well. The exercises are so easy for them. The activity is so easy for them. There is no challenge. So they will feel, oh, these sessions are not useful for me. So using the just right challenge is also a magician tool for occupational therapy. So they grade up, they grade down, and they play with these circles. And that's why sometimes our definition of occupational therapy, sometimes it's really complicated to tell people, but we have an obligation to really understand what we are really doing in order to help patients. So let's now talk about occupational therapy globally. So I am from Jordan. I got educated in the US, and working on the project, the master project with Professor Karuduman, I got to know a little bit about occupational therapy and ergotherapy in Turkey. And just to understand what's going on globally for occupational therapy. So the World Federation for Occupational Therapists is actually the global voice for occupational therapy, and it sets the standards of the practice of occupational therapy. It's interesting to know that over 500,000 in the world are occupational therapists. So 630 something thousand occupational therapists are around the world. And we share the passion of being an occupational therapist. So there are about 107 member organizations. So in Jordan, we have the Jordanian Society of Occupational Therapy. I'm not sure if the Turkish organization of occupational therapy is active, but if it's not, I think it's our obligation, all of us, is to make this happen. So you really need an occupational therapy body in any country to improve the practice, to improve the standards, improve the quality, sets the quality of education, and also service delivery in any country. And there are about 1,100 educational programs. So if we go to the WIFIT, and the WIFIT website is, so this one, I thought this is a Cappadocia city from the picture. So as you see, 630 something thousand occupational therapists around the world. And when we sit together as international occupational therapists together, we really have shared challenges, and we have shared vision. We have shared problems and aspirations to do for our profession. All educational programs have to be accredited by WIFIT. That's a plus. So if you go, like, for example, here, so education, and you check Jordan. So you have the name of the university in the website. I am sure that the Turkish universities are also involved in the effort of WFOT. And we also, in Jordan, and I'm speaking about on behalf of the Jordanian Society of Occupational Therapy, that we really can help in any way to make sure also most of the universities in Turkey that offer occupational therapy are also accredited through WIFIT. So if you are accredited through WIFIT, it makes easier that you move and work in different countries internationally. So you are not only, I'm not only a Jordanian occupational therapist who work in Jordan only. I can go and work in other different countries depending on the legislation for practice. The interesting thing to say for WIFIT and similar between Turkey and Jordan, that we have undergrad, we have master, and we have PhD in occupational therapy. But the world, the whole world, so many countries in the world, let's say, have moved from undergrad to the doctoral degree in occupational therapy. So in America, for example, the entry level for occupational therapy is a doctoral program. And they ask students to have any health-related profession or bachelor degree, for example, psychology, nursing, pre-med, and then the entry level for the occupational therapy education is a doctoral level, and it's called OTD. So these are different trends worldwide. The question, are we in Jordan and Turkey are going to that direction? Probably, but probably it's too early for us to go that route. But probably 20 years from now, we are going to that direction to offer doctoral degree, entry-level doctoral degrees for occupational therapists. They claim in America and the other countries that implementing this idea is that it will give more identity to the profession. Similar to the physical therapist as well. So there is DBT. I'm not sure if there is DBT in Turkey, which is a clinical doctorate of physical therapy. The OTD is a clinical doctorate in occupational therapy. But I think we are going to that direction as well. But we have to prepare ourselves. We have to prepare our education to be more competent to deliver entry-level doctoral graduates in occupational therapy and entry-level graduates of physical therapy as well. OT globally, also you have OT Europe. OT Europe is another organization, and actually, this is one of the occupational therapy staff, I think from Hacettepe University. Also, we met in one of the e-note presentations. So I also invite the Turkish universities who teach occupational therapy also to be part of OT Europe. Because of the very close, borders with Europe, the proximity with close to Europe, So there is Kotick and eNote and Rotus. So and it's about education. So eNote is about an association about how to promote the principles and the standards of education in occupational therapy within Europe. And you are very close to Europe. And Rotus is promoting research in occupational therapy within Europe, and Kotick is also promoting the occupational therapy practice within Europe. I think Turkey is a large country, and you have so many different universities now teaching occupational therapy. And I think you have so many advances in the world of occupational therapy. For example, you have an occupational therapy journal, which is really great, that you are setting the standard of practice and research within your country, and probably in the Turkish language, which is really great. So going back, what are the global directions of OT? In general, also for other professions, because we share in OT, we share as many other allied health professions, the global problems and the global trends that are impacting healthcare. So generally, we have demographic and societal change. So we have a problem with, not a problem, we have aging population nowadays. In our culture, we appreciate the elderly, but it is now we have more population, we have more elderly population. And this will impact the need and the demand for the profession. There's also rising expectations and consumerism. Patients now, they are aware of what they need to accomplish. So when someone as a client comes to you, they are actually aware of their goals and their expectations. And they want us to deliver quality services. Nowadays, with the rising technology, we have health informatics trend and telemedicine trend, especially after COVID. And we have to be aware and on track of what's going on. We have new medical technologies for gait, for assistive technology, and we also have to be aware of all that. There is increasing cost, and we have to make sure and we have to advocate for our clients using the insurance and the funders and all that. And definitely we have new trends of healthcare delivery and focus. So as I mentioned, our population is not only individuals and groups, but we can also expand to community. So the community-based rehabilitation model is also another model that we have to embrace very soon if we are not embracing right now, because these are the global trends of service delivery. And we have to make sure not only occupational therapy, most health professions, and especially allied health professions, we are focusing more now on prevention and health promotion. We don't want our patients to be sick. We want to prevent that. And we have to be at the front line of preventing diseases like many other professions, including medicine. We don't want to go back to the medical model, which is just treating. We want also to prevent and help promote our clients. So the OT vision is that we should have evidence-based occupational therapy that is client-centered and cost-effective. We have to have evidence, not just as some clients and parents, they say, you are just playing with my kid. No, we should have evidence, and we should show the evidence, and we should document the evidence in research, and we should also talk about it to other health professions, including physicians and other colleagues. And the best colleague is physical therapy, actually, and nurses. So we have to talk about our evidence. And we have to advocate. We have to become very influential. We have to turn the way. Instead of people asking us what occupational therapy is, we have to go to the government. We have to go to the schools. We have to go to the companies and to the doctors and tell them what we do. It's very interesting that we have to promote ourselves. And there are so many different ways to promote ourselves. And we have to do it collaboratively with other professions, with clients, with other stakeholders. And we have to be accessible services. And we have to make sure that we are independent in providing services. And probably having a doctorate in occupational therapy, it makes sure that you are an independent service provider. And that's what we are looking for in occupational therapy, hopefully in Jordan. And I think you are also going to that direction in Turkey. So what is OT vision for the world? Let's watch another.
AOTA unveiled its centennial vision in 2006. We envision that occupational therapy is a powerful, widely recognized, science-driven and evidence-based profession with a globally connected and diverse workforce meeting society's occupational needs. The centennial.
So that's a promising vision, not only for the American side, but also for the world, is to be powerful and recognized profession, science-driven, evidence-based, and globally connected. And thank you, Professor Karuduman, for inviting me to this presentation. Is that we should have connection, global connection, and we should be able to meet our society occupational needs.
Vision really became very widely disseminated and enthusiastically embraced. We are a science-driven, evidence-based profession, with many of us funded by prestigious funding agencies like the National Institutes of Health.
Today, a license to practice is required in all 50 states and 3 jurisdictions.
I can get my washcloth, my long brush for my back.
The thing that is clearly our domain is occupation. The impact of occupation on human beings, which was spelled out for us as our sole claim to professionalism back in 1917.
It's been 100 years, an entire century, since the founding meeting of the American Occupational Therapy Association. And what began with 6 people in a small village in upstate New York has grown into an association.
I have to say that this is me. And that's the Centennial Occupational Therapy Conference. I think it was in Chicago.
Association that today is 60,000 members strong.
We are two examples.
So I think we can make it, and we can make occupational therapy more powerful. We can learn from what's going on in the world right now. We can learn from each other as countries. We can learn from other disciplines, occupational therapy and physical therapy and nursing, for example, and we can be stronger, and we can actually meet our clients' needs by just remembering that we have art, we have magic to do, we have magic to play with. The capacities of the person, the demands of the activity, and the environment where this happens. If we can play, if we can play with these domains, we can provide magic and better well-being and better quality of life for our profession, for our clients. Thank you so much, Professor Karaduman. Thank you so much, students and staff, for attending my lecture. And if you have any questions, this is my email.
Okay, thank you, Mohammed. It was a great presentation and very impressive. Thank you very much. I hope we will meet as soon as possible, and we can make a collaboration with you and your staff and your colleagues. Do you have any questions? Herhangi bir sorunuz varsa lütfen sorabilirsiniz. Furkan Bey, soru geldi mi?
Soru görünmüyor hocam şu anda.
No. All students want to say thank you.
Welcome. Welcome.
And Furkan Bey, ağaç sertifikamızı koyabilir misiniz? Muhammed, we planted a tree for you. And this is the documents of the tree. But in Turkish, as you see, we will prepare an English one. Okay.
Yeah.
I will send
I have a translator. I have a translator.
Yes. Aisha is here.
Yes, Aisha is here.
Okay.
So if you have questions also for Aisha.
Yes. Öğrenciler, belki Ayşe şu anda orada Erasmus nedeniyle bulunuyor. Ona belki soru sormak istersiniz. Var mı sorunuz? Soru var mı Furkan Bey? Onlar daha sonra sorularını ileteceklerdir sanıyorum. Çünkü YouTube'dan da izleme olanakları var artık devamlı olarak. Dolayısıyla da o zaman sorarlar. Ayşe de benimle Türkiye'ye gelince görüşelim, olur mu Ayşe?
Tabii ki hocam. İstediğiniz bir şey olursa gene haberleşiriz inşallah.
İnşallah, evet. Peki, thank you very much Muhammed again. And I would like to say hello to all my Jordanian colleagues. And love my love to your family.
Thank you.
Thank you very much.
Thank you.
I hope to see you soon.
Bye-bye.
Bye-bye.